Sedation is carried out in Scottish Centre for Excellence in Dentistry in a couple of ways. We use oral sedation for patients who are slightly anxious, so they will have some medication an hour before treatment, which relaxes them quite considerably. If patients are more anxious, then we have medically qualified doctors who provide the sedation in a very safe and comfortable environment. One of the big advantages of the type of sedation we use is that patients don't have any memory or recall of the treatment. So we tend to reserve that mainly for bigger cases where we're carrying out, for example, same-day teeth all-on-4 surgery, so more for more major surgery, and also for very anxious patients. But our aim with anxious patients is to get them receiving treatment with no sedation. So we use other techniques such as hypnotherapy, which we find it can be very successful for patients who have a fear of having dental treatment carried out. Very often, 90% after 2 or 3 sessions of hypnotherapy will be able to receive treatment without sedation.
There's people who nervousness becomes something that would stop you going to the dentist. And of course, anything from a simple procedure all the way through to a lot of the very complex work that we can use to rebuild people's mouths does create anxiety. Sedation's fabulous for that. We have very dedicated clinicians that come to our practice that will one-to-one look after you whilst you're sedated. We don't have one person sedating you and also doing the work. We have someone looking after you whilst you're sedated, keeping the correct level of sedation, making sure you're comfortable. And then afterwards we have the facilities to look after you whilst you're recovering from that sedation. And then we think that the future will be that patients who perhaps have already had sedation with us will tell their friends that are also nervous to come and see us because we can get you through this.